What do cancer lab test abbreviations like CBC mean? Imagine trying to understand a new language without a translator. Medical abbreviations can feel that way, especially when they relate to cancer tests. One of the most common abbreviations you might see is CBC. It stands for Complete Blood Count. This test is a routine blood check that provides important clues about your loved one's health. A CBC measures several key parts of the blood. First, red blood cells carry oxygen from the lungs to the rest of the body. If these cells are low, it can lead to anemia, which makes people feel tired and weak. Next, white blood cells help fight infections. Abnormal levels might mean an infection or even blood cancers like leukemia. Platelets are tiny cells that help the blood clot. If these are too low or too high, it could point to bone marrow issues or certain cancers. Hemoglobin is a protein inside red blood cells that carries oxygen. Low hemoglobin levels often mean anemia. Hematocrit shows the percentage of blood made up of red blood cells. Doctors look at all these numbers together to see how well the body is functioning and how cancer or treatments might be affecting it. Doctors use CBC results to monitor overall health and see how treatments like chemotherapy are working. Chemotherapy can lower blood cell counts, so regular CBC tests help doctors decide if adjustments are needed. While a CBC can't diagnose cancer by itself, it can reveal changes that suggest further tests are necessary. For example, abnormal white blood cell counts can be a sign of blood cancers like leukemia or lymphoma. Sometimes, solid tumors that affect the bone marrow can also cause abnormal CBC results. For families and caregivers, understanding what these test results mean can be very helpful. If you see terms like low hemoglobin or high white blood cells on a report, it shows the doctor is checking for possible causes, which could include cancer, infection, or side effects from treatment. Other common lab abbreviations include WC4 white blood cell count, RBC4 red blood cell count, HGB or HB4 hemoglobin, HCT4 hematocrit, and PLT4 platelet count. Knowing what these abbreviations stand for can make you feel more involved in your loved one's care. If you're unsure about any results, don't hesitate to ask the healthcare team to explain what they mean. This way, you can better understand your loved one's health journey and support them every step of the way.